Welcome to the Dental Breakdown Show. This show is where we break down issues in the dental marketplace. My name is Christian White, CEO of White & Associates Practice Consulting, Better Business, Better Dentistry. Today is podcast number 20, and we are talking with Greg Keuster, the President and CEO of NPF Health Benefits. Greg, welcome to the show.
Hi, Christian. How you doing?
I'm doing great. Say, why don't we start off this morning by having you tell our listeners a little bit about yourself?
Oh, sure. Well, my name is Greg Keuster. I grew up in Roseville, Minnesota. I'm one of four boys. I'm also a twin. And my entire life, Christian, who knew?
Yeah, who knew?
People you chuckle, they take a second, they think about it, like your entire life.
I know.
We are fraternal twins. And then I went to the University of Minnesota Duluth and majored in accounting and business management, 2 full degrees from UMD.
Wow. So I just so everybody knows this, my wife and I are about ready to have twins. So you are a twin and I'm going to be raising twins.
Good luck.
Thank you very much for that. So we're pretty excited.
It's great. It'd be great.
Yeah, it's going to be great. So listen, tell me a little bit about your business. So how did you get involved in the health benefits business, if I even said that correctly? How did you stumble into that?
Well, it wasn't the idea in kindergarten, when you're taking your nap and you're dreaming about what you want to do as a profession when you're older.
No.
This health insurance agent never hit the top 10 or honorable mention for that fact. I kind of fell into it. Back in 2008, I was invited to become a financial advisor with a local financial planning firm where we focused on investments in people insurance, life, disability, et cetera. And there was a gentleman in the office that became a mentor of mine, and he's 30-year second generation healthcare insurance agent / financial advisor. Now his son has taken over the practice. And so 3 generations there of providing health insurance group benefits. And this gentleman would come out with me as I found clients for health insurance. And I would just sit there and listen to them. And I realized I enjoyed it. I don't know how someone could enjoy health benefits, but it was interesting to me. Yes. And I could see people were confused with it. And I saw people had questions. And at the end of the day, people need health insurance. It's a want and a need. And so, over the years of being a financial advisor and offered health insurance, this little law came into place called the Affordable Care Act. And I realized that people would be confused of what President Obama was trying to do with health insurance and how it affected them, et cetera. And so I attended a presentation with a CPA, and I called her up afterwards. She was talking about the Affordable Care Act. I called her up afterwards, asked her for a copy of her presentation. And I said, "How did you learn this stuff?" She said, "I Googled the IRS Affordable Care Act law, which is 9,500 pages. And so for 7-8 months, give or take, I would sit at home at night from 9 o'clock to 11 midnight, 10 o'clock p.m. to 11 midnight, 3 to 4 nights a week, reading the Affordable Care Act law." And I realized that people were going to be confused. And I realized that people needed guidance on this. And there's not a lot of people know a health insurance agent. Financial planners are a dime a dozen. There's a lot of them out there. Some of them are good, some of them aren't. But health insurance agents, there's not very many. There's a lot that most people don't have a connection with on. So I would read the Affordable Care Act law, and I started calling CPAs that I knew, and they invited me to come into their office to talk to their staff about the Affordable Care Act law, health insurance, the penalty, et cetera. What exactly did President Obama try to do? And I just boiled it down to a few bullet points. And then they started referring me out to their clients. And from there, I thought I could do this on my own 100% of the time. And so I went out and got the agreements with the different insurance companies to offer the health insurance. So I kind of stumbled into it and realized I enjoyed it.
Well, that's kind of interesting. I mean, I guess, I have to say this, you are the only person I know on the planet who has read the entire Affordable Care Act and gone through the entire 9,500 pages. So, I mean, that alone, man, that puts you in a group unbeknownst to yourself.
Well, I didn't, just so we're on the same page, Christian, I didn't read the entire 9,500 pages.
Okay. All right.
I got through a good portion of it.
All right.
I couldn't tell you how many I actually read, but if anyone has an issue with insomnia, Google the Affordable Care Act, and yes, I was sitting and drinking some coffee and reading it, and I probably bet you got through about half of it, a little more than half of it, and there's a lot of that in there that has some of the law has nothing to do with health insurance, but so that stuff I kind of skipped. Um, but I got the nuts and bolts down, and that's kind of what led me to where we're at today, where 99.9% of my revenue comes from health insurance, whether it's group benefits, group medical, ancillary. And ancillary would be your secondary benefits like dental, vision, group health, or excuse me, group life and disability. And then I do Medicare and then individual insurance.
So, Greg, how do you, interact with your clients? When they have a health insurance need or they're confused about something, how does that whole process work when they call you up?
Well, depending if it's a new client or a prospect or a current client, current clients, I really focus on education with them. We reach out to our clients anywhere from 45 to 60 days to the renewal to review where they're at with their health insurance plan and group benefits going forward, Medicare and individual people too. And then from there, I also set up annual meetings with their employees. And so when employees have questions or concerns, I put together about an hour presentation. It's about maybe 30, 40 minutes of presenting their group plan, presenting their medical benefits, group benefits, digging down to what is a deductible, what is a out-of-pocket max, what does a network mean, why do I care about being in a network, what does a co-payment mean? And then from there we have Q&A, and I make it very casual. And so when someone has a problem, or excuse me, what I try to do in the front end is try to nip some of the stuff in the butt sooner or later by presenting to the clients. And then I make myself available to any employees that if they have questions, concerns, we can do a phone call, we can do a Zoom meeting to walk them through their benefits. And then if it's a new client, try to really understand their issues, their concerns, why are they trying to provide benefits, what's the ultimate goal. And then we sit down and have a really good conversation of how does this work? What are they responsible for? How are the employees involved, et cetera. So we really try to make ourselves available to the prospect or to the current clients to resolve any issues or concerns they have.
The Dental Breakdown Show, sponsored by White & Associates Practice Consulting, Better Business, Better Dentistry. They are a practice management consulting firm for dentists and other healthcare-related businesses. Their sole purpose is to implement proven strategies through online and in-practice visits and result in the personal and professional success of the dentist and his or her team. Whew. Wow, that's a mouthful. Say that 4 times fast.
Right.
Greg, our company, we do a lot of work with dentists. We do a lot with dental practice management. And one of the questions that I get asked about a lot is, what about healthcare benefits? What do you know about that? What have you heard about that? And this is a real need, in the dental marketplace, with all of the dentists. Tell us how can you provide value to the dentists?
Well, you can think of us as a broker consultant in this field. There's 3 types of people that work in the healthcare field that I've personally concluded. You have a hobbyist, a person that sells on commodity, and then there's the consultant. And what I mean by that is that I have a hobbyist. They're a financial advisor. They're a property casualty agent that can sell health insurance because they can. They have all good intentions to provide good service and offer a group medical option or individual option or Medicare option to you as a consumer. But for example, I had a prospect, this is probably 10 or 12 years ago now, honestly, it's been a little while, here in the Twin Cities that I got referred into a company, about 25-ish employees. And he was with the same health insurance company for like 17 or 18 years. And I asked him, well, why are you with the same healthcare insurance agency for that long? This particular company I represent myself to, they're a good company. There's nothing wrong with them, but networks change, premiums change, your needs for your employees change. The Affordable Care comes down, and there's things that there need to change, right? And so he said, well, my agent tells me it's the best out there. His agent was also his property casualty agent. So he offered his liability for the building and equipment and office and whatnot. Well, comes to find out, his property casualty agent only had one agreement. And that was the one agreement with this particular company for 17, 18 years. And to me, I have all 5 agreements. And so when there's 5 major insurance companies in Minnesota, Preferred One, Medica, Health Partners, Blue Cross Blue Shield, and United Healthcare. And so at the end of the day, we provide value because we look at those companies, we looked at what you're trying to accomplish as an owner, and we try to consult with you. The second realm of where we provide value is that we're not going to sell you the cheapest plan. We're not going to try to sell you the most expensive plan. Our goal is to consult, understand what you're trying to accomplish as a business owner, what your goals are. I have a company in northern Minnesota that needs to get on a group medical plan here in June. Not to go into too many details, but their current plan, they're not eligible for anymore, for lack of better words. And there's office staff that needs to get health insurance, and she's the owner, one of the owners, is concerned that a couple of the office staffs are on some public programs, medical assistance, Minnesota Care. You can be on these programs based on your income and the number of people in your family. Well, the minute in Minnesota that you're eligible for health insurance for your company, medical assistance you can waive. It's a public program through the county, federal and county funded. Generally, the premiums are free. Generally, the going to the doctor is free. There's no cost. But you have to tell your county about your medical offer through the employer, and the county then decides if that's affordable or not to you. The broker doesn't make the decision, nor does the ownership. And so it's up to the county. Then you have Minnesota Care, which is one step higher in medical insurance, where the state of Minnesota, we're one of 2 states. Massachusetts, I believe, is the only other state that has the program like we have, which is called Minnesota Care. It's ran through the state, Minnesota Department of Health and Human Services, DHS. And the Minnesota said, look, you don't qualify for the federal medical assistance program, but based on your income and the people in your family, we'll help you with this insurance, where the premiums are real reasonable. It could be $1 or $2 a month to maybe $150 a month for family. There's a chart that determines what your premiums are. So very, very reasonable in premiums. And so a couple of their employees are on that. So when they say we add value, a handful of the group benefit medical insurance companies will allow us to categorize people. And so I sat down with the owner, talked to her about her concerns, and she said she didn't want these employees that are on these programs to have to go on our medical plan. She goes, I'll pay for it, but then they have this out of pocket that they're going to be responsible for, and I don't want to put them in a worse situation. And so with a handful, the 3 of these out of the 5 will allow us to categorize, where we can put a category around what their particular company. We're going to do the owners. You have to work 40 hours a week, and you have to also have a title as a foreman. And so if you're not an owner, you don't have a title as a foreman, or you work less than 40 hours a week, you're not eligible for the insurance, so you can stay on the public program. And she thought that that totally relieved her. She was really genuinely concerned for these couple employees of that, will this screw up their insurance by them having to go on this group plan? And so we try to provide the value there on understanding their situation and making it work to be a win-win for everyone. And that's where when we talk about selling a commodity, our goal, if we really were concerned of selling the highest price, we would have just went in there and told them, like, no, all employees have to go on the plan and get them all on the plan and not worry about it. But like I said, we try to consult. And I view my clients as if, are these my parents? Are these my brothers? Right? What would I tell my brothers if they were in this situation? What would I tell my parents if they were in this situation? And where I also provide values, I've had employees call me up and said, hey, I just got married. During these presentations we give to the employees, their staff, they have our numbers, they have our email address, so they can reach out to us. We make it very clear, anything you tell us as your consultant in health insurance isn't shared back to the ownership or any management at the company. You're trying to figure out how to best use your health insurance. So I had this one gal a couple years ago call me up and said, hey, I got married, and my husband works for a very, very big company here, and I don't know what to do. They offer health benefits, you do at my company. And I told this Jane Doe gal to email me. I said, email over your husband's benefits. We set up a time a couple of days later to go over them. And they were very good benefits, very reasonable. The premium for the two of them to be on the same plan, Christian, was less than for her to be on the plan by herself through the benefits I provided.
Wow.
And so I told her, I said, look, go on your husband's plan. Now I get paid a commission for every employee to be on that plan. But the right answer for her was go on that medical plan. Now, if your husband loses his job, walks away from the company for whatever reason, you and your husband can come back to the group benefits of this company that you're at now. That opens up what's called a special enrollment period. But in the short run, it makes more sense. So if this gal was my sister, that's what I would have told her. So that's how I try to provide value to the ownership and to the employees, that when the owner wants me, management wants me to talk to their employees, that I am trying to give them as impartial advice as I can, understanding their situation so that they can use their benefits the best they can, or put them in a better financial situation, whether that's a public program or their spousal benefits. Hi, my name is Greg Keuster, president of MPF Benefits. MPF Benefits is a health insurance agency located in North Oaks, Minnesota. We work with business owners to design, implement, and manage your healthcare strategy. We provide benefits that actually benefit you.
So, Greg, if I'm a dentist and I have, long-term staff, which a lot of dental practices do, which is normally a good sign that the dentist, is treating his staff well. They have really low turnover, and he would like to offer a healthcare benefit, as a tool, to help them continue to work at the office as a retention piece. Now, is that something where you can come in and help them out with that? And you would sit, how does that work in terms of picking the plan out, the group piece, trying to figure out what's best for the office? How do you do that?
Oh, sure. Yeah, what we'd do is we'd set up a time to sit down with the owner or owners, and any stakeholder that he or she would like to be in there, whether that's the HR manager or the operations manager. Right now, we'll do Zoom meetings if they don't want me to come to the office. So we're happy to set up a Zoom meeting to accomplish this. But I do, from financial planning world, it's called a fact finder. It's a form that the financial planning world has developed to really understand the facts. What does Christian White on a financial planning basis need, him and his wife? Oh, you're having twins. Oh, you own a business, etc. And so I took that concept of my financial planning world training and moved it into health insurance, because like I said, I try to sell and provide value based on needs, and then anticipate what the client needs, and make sure that they understand the full picture of how benefits work. How we sit down and through this fact-finding process, we understand the facts. Well, what are you trying to accomplish? Why do you want benefits in the first place? What's your budget? Have you ever done group benefits before? No, we haven't. Or yes, I actually came from another company we did. And then understanding who would I mainly work with, because a lot of the times in dental practices or in businesses, I'm not necessarily always working with the owner. I'm working with someone, the office manager, the HR director, to get stuff done, and the owner is just given the blessing, right? And from there, we dive into understanding how many employees do we have? Are we under 50, over 50? Because once you hit 50 full-time equivalence employees, then the rules change. And we walk through, what do you want to offer? Depending on the group size, we can offer 2 or 3 different medical options. Depending on, sometimes we send out a survey to the employees where I have a bunch of questions of what are you guys? There's times where I talk to business owners and they sit back and they say, well, I don't really know what my employees want. Some of them have talked about medical, but some of them may want a group disability. Some may want life insurance. Some may want tax-free savings on their health insurance, like an HSA, health savings account, or a flex spending account, et cetera. And so sometimes we send out a survey to the employees if the ownership, management, decision makers want that. And so it boils down to sitting out with the client, understanding their goals, understanding what they're looking for. And they may not know what they're looking for, but through the process I've developed, I can kind of pull apart what they're looking for and how to try to fit it within a budget. And then from there, offer some additional values that they may not even be thinking about. For example, flex spending dependent childcare plans. If you have a child under 13 that is taken care of, that you pay a monthly daycare fee to, whether that is a school daycare, a private daycare system, or your sister who comes over and watches your children, you pay her or your brother to watch your children, you can actually run that through your payroll and save on state, federal, and FICA tax. Based on my position with the company that I use, I can get that. It's a $400 fee. I can get that waived. Yes, it's an annual fee of $400 to put into place. I can get that waived, and walk them through the benefit of what, if you have a bunch of employees that have child daycare needs, we can educate your employees on how this works. They can save state, federal, and FICA tax on up to $5,000 of their child care payments needs.
Wow.
Invoices, and then the owner, the company, saves on their share of FICA tax. And so if you do the math, it's over $300 and some dollars, 382 if I remember right, of FICA tax savings on the $5,000 saved in a year's time, just by them. They're already paying them the $5,000. They're just taking it from the left hand, putting it in the right hand, and it's tax free. Now, we set up all the legal documents to make sure that they're in compliance with the Department of Labor and the IRS for this. And we're one-stop shop with all the compliance aspects of setting up plans. But something like that, where I can talk to a company, say, look, here's another benefit we can give you. Yes, it's normally $400 to put into place, but we can get that fee waived, and you're providing some benefits to your employees.
Wow.
Does that make sense?
Yeah, absolutely. I didn't miss a beat on anything you said. That was great. No, I just, in the dental offices, I mean, and not just the dental offices, when you go into another healthcare office, like a pedodontist, an endodontist, ortho, optometry, they all have the same problem when it comes to talking about the healthcare piece. They would like to do something for their employees. They just don't know how to implement it, and they don't know where to go because they just don't have a resource to do that, Greg. And that's why I have you on the show today, because you can be that resource. Thank you for listening today. I'm Christian White, the CEO of White & Associates Practice Consulting, Better Business, Better Dentistry. If you would like more information on today's topic, you can contact us at whitedentalconsulting.com/breakdown. Keep those teeth white, and see you next time on the Dental Breakdown Show.